Dr. Malea Jensen. Welcome to Dr. J's Prescription for Health. I am your host, Dr. Malea Jensen. I'm a board certified family physician. I'm located in the heart of Iowa. I've been practicing family practice medicine for, I know that sounds crazy, right? Practicing. Exactly. I've been practicing medicine for 27 years and I'm glad to have you here. This is your chance. This is your space where you can ask medical questions. Please keep the questions succinct and complete, and we'll try to get them answered. If you want, you can put a QQQ in front of the question so I know that you are asking a question instead of just making a comment on someone else's post. All right, well, let's get started. Welcome, you guys. I appreciate you being here. Good morning, Lucy and Anna. Where are you guys listening from? Lucy, where are you at today? Where are you at? Are you back home? All right, the first question over there on, looks like on YouTube, what are your thoughts on Ozempic face? What are my thoughts on Ozempic face? What is Ozempic face? It has been thought that when people are taking Ozempic, they are actually losing fat so rapidly that they're losing the fat pads in their face as well as muscle. So when we have extreme weight loss, then we are causing, look at my hair. We are causing, weight loss not only all over our body, but especially in our face. We'll notice this with bodybuilders. People who've been bodybuilding for years, including myself, we do get problems with loss of fat pads and not so much muscle, but loss of fat pad in our face. You know, my thoughts on it is, why use a medication that's in high doses, super physiologic doses compared to our normal production of GLP in our body? Why not just follow a low carb or no carb, high fat, moderate protein diet? You'll get the same amount of weight loss. You'll maintain your muscle. You'll lose body fat over time, and it's safer. That's up to you. But yeah, I just think that what we're doing by taking Ozempic is we're causing a more nutrient deprived state. You're eating less. You're taking in less nutrients. You're likely continuing to eat the exact same foods that you were eating before, just less of them. They were already nutrient deprived, and now you are eating less. So if you change to an animal-based diet that's high in fat, moderate amounts of proteins, no carbohydrates or very low carbohydrates, you'll have all the nutrition you need. All right? Okay. Lucy says, I missed you. Busy life here. Yes, back home. Was in Tahoe last week. Bear got into our garage and took some trash. I never saw a bear so close. Wild. Had the best time. I'm happy to hear that. I'm glad you're safe and glad you're back. All right. Hello, Larry, over there on YouTube. Thanks for joining. Here is a question. Will a carnivore diet make my hernia worse? I'm guessing, we can have hernias all over our body, but I'm guessing you're meaning a diaphragmatic hernia. So a hernia in your diaphragm called a hiatal hernia. I'm guessing that's what you're talking about. You can also have abdominal hernias, but no, neither one, or inguinal hernias, but no, carnivore diet will not affect or worsen your hernias. Now, if you have an abdominal hernia or you have an inguinal hernia and you end up losing weight, it might be more pronounced, but the diet itself did not cause you to worsen your hernias. Any weight loss could make the hernia look more pronounced. You're not going to so much see a diaphragmatic hernia because that's in the diaphragm. Sometimes people who have very thickened diaphragms, they will see what appears to be evidence of a diaphragmatic hernia. But more likely you're seeing an abdominal hernia, so it's down the middle. You'll have a bulge when you are doing a crunch or just getting up out of bed or out of a chair. That hernia will bulge. When you lose weight, that bulge might appear more pronounced. It is not more pronounced, however. All right? You're not going to reverse your hernia by doing any diet. But any weight loss diet might make that hernia look more pronounced. Will they hurt you? No. Do you need them repaired? No. Sometimes they're unsightly and people want them repaired. I have not seen strangulated abdominal hernias. I've never seen a strangulated inguinal hernia, not to say that it cannot happen. Good morning, you guys. There's Omar. Thank you for joining. I am doing well this morning. Dr. Jensen, I am sorry to hear about your dad. I watched your reel on here, and I need to ask, okay, I'm sorry, I'm having trouble reading this question. I need to ask, what did your dad eat? Oh, what did your dad eat? Oh, that's a good question. And yes, there is a reel or what I call a carousel that is out right now that was done by Divine Carnivore, Divine_Carnivore. Gail took my dad's story and put it into a comic strip and portrayed what my dad's history over time. And I thought it was a great honor. No, you cannot take these things and it's written in stone that because my dad was on a statin, he got all of the diseases. No, we are not saying that. We are saying that it is important to know what medications you are on and for what reasons. What did my dad eat? Well, prior to him going to doctors for wellness exams, he ate like any American. And my dad did not grow up on a farm, but he ate what I would consider farm food. We had roast and hamburgers and potatoes and vegetables. We ate meat. We had chicken, but we had hamburgers a lot. We had some steak. I mean, one of my favorite meals growing up was a ground beef steak. I didn't need anything else. But when my dad, one time he went to a wellness exam and they did his cholesterol, they did his labs, he found out that he had high cholesterol. They told him to go on a statin. My dad trusted his doctor. My dad went from eating red meat on a regular basis. I mean, I'm talking almost every day, if not 4 days a week. He stopped eating red meat and he started eating chicken and beans and rice and vegetables. And he would eat flaxseed and he would eat bran flakes and sugar-free ice cream. He did all those things and he did them for years. Now, back in that day, we did not have the ability to do a coronary calcium score. So we don't know where he was at, but because my dad's dad had coronary artery disease, it was therefore told to my dad that because of that family history, he needed to be on a statin in order to prevent him from having a heart attack. Now, if we fast forward on the statin, on the beans and rice and vegetable and chicken diet, along with sugar-free ice cream every single day with bran flakes every single day, my dad got coronary artery disease. My dad was an exerciser. He ran every single day. When we exercise, and what people are not telling you is the importance of exercise helps build collateral blood flow in your heart and other areas of your body. Collaterals, even if the main arteries are blocked, collaterals can help the area survive. Collateral blood flow, it's like a branched tree. Because my dad exercised, he never had side effects of blocked arteries. Those blocked arteries took decades. I am not saying that my dad was a carnivore by any means. He ate what I'm guessing is a standard American diet. Hamburgers and hot dogs and soup and sandwiches and potato chips. He ate those things. Is that the best thing to do? No. He ate, I'm sure, a lot of sugar. He told me he worked in a parlor an ice cream parlor. So he served people ice cream. I don't think that my dad refrained from eating ice cream. In fact, into his older years, he was eating ice cream, but he changed it to sugar-free. I'm doubtful that that was helped his situation. But he took the statin. He took a blood pressure medicine. He didn't have high blood pressure. He took it anyway because they told him it was good for his heart. Over time, eating this way, my dad started stumbling. He said he was getting some dizziness, but I checked his blood pressure. We did lower his dose. We didn't really look into anything else, but we lowered his dose of his blood pressure medicine, his doctor, at maybe the urge of me. Okay, I was in medical school, and maybe you just got orthostasis. So we lowered that. And he actually worked out with one of my very good friends back in our hometown, who's was a veterinarian there. And she was working out with my dad, and she actually noticed that my dad seemed to get more unbalanced. And so one day my dad was walking his dog in the park, and he slipped. Well, I don't think he slipped. He fell. And it made it sound like the dog got wrapped around him. But I know my dad well. And my dad walked in the fairgrounds, and he always let the dog run free. Yes, the chain was on him, but the dog was never around us when we walked. And so I think my dad simply just lost balance and fell. He broke his femur. He had it repaired, and everything was fine, but it didn't stop the unsteadiness. Well, one day he fell in the bathroom, and luckily a neighbor was knocking on the door and heard my dad yelling and got him to the hospital. And these things that you guys don't know about, but there's not really neurologists in a small town where my dad was living. And so me being in Des Moines, I took my dad to a neurologist, and they diagnosed him with a form of Parkinson's disease. It is called progressive supranuclear palsy. My dad was on a statin for years prior to this. My dad was also on blood pressure medicines late in the stage. Am I saying that statins are the only thing that led to my dad's neurological problem? I am not. Are there side effects of statins and cognitive decline and demyelination of the nerves? All of these things are very common with statins, and doctors are not informing patients of this. They also increase our risk of getting diabetes, not because they cause diabetes, but they decrease our ability to manage our blood sugars. And here my dad is eating all of this ice cream and bran flakes and rice, and he ate pasta. He ate a lot of spaghetti. He didn't get any good fat. In fact, he was low fat. He was boiling his chicken, taking a statin, lowering his cholesterol. I can only tell you my story, my dad's story, and I want it to be a representation that these medications that you're being put on by your doctor are not side effect free. High doses of the medicine, even this Ozempic, these are supraphysiologic doses. We have never studied low LDL cholesterol. We've never even studied it. They keep lowering the goalposts. More and more people are getting demented. Do you know what they're saying? Well, they're just living longer. And there's just more people. People are just living longer. And there's going to be more dementia. I don't believe that. I believe these medications, this polypharmacy. I did a reel today on polypharmacy. Polypharmacy is real. Polypharmacy is taking 5+ medications a day, sometimes multiple times a day. Sometimes the primary care doctor, I'm a primary care doctor. What if my patient went to the cardiologist, the neurologist, the urologist, the gynecologist, the pulmonologist? What if they were going to all these doctors and they were adding medications and then the patient just forgot because, well, maybe they thought that I was just in the know already. I don't have a complete list sometimes of my patients' medications. I'll ask them, hey, do you have your medications changed? Has anything been added? They might have forgot. And this is a danger, especially as people age, because as people age, they don't deal with medications as well as they did in the past. And this polypharmacy leads to all kinds of problems: fatigue, brain fog, dizziness, organ damage from taking multiple medications. And so this is why that we need to ask our doctor, hey, can you review all these medicines? Are there any interactions? Go to the pharmacist. If neither of those will do it, go to ChatGTP. Plug in your medications and the doses and ask AI if there's any interactions. Get a list. Take this back to take it back to your doctor and say, hey, I read this. And, I'm concerned. If you're a child and your parents are elderly or seniors and they're on a lot of medications, help them. Go through their medications. Go to the doctor with them. Be an advocate. We need to protect our seniors. Whether it be a neighbor or your family member or somebody, a family friend, these people need an advocate, and that can be you listening right now. I am honored that Divine Carnivore, I think it's Divine_Carnivore, did this comic and highlighted the life story of my dad in a carousel of a comic strip, because this is real. Multiple patients have been commenting. The followers and the listeners, they're commenting on this comic and say, hey, this is me. Hey, this is my parents. This is what happened. You guys, a statin is not going to prevent you from having a heart attack. A statin is not going to cause plaque regression. There's no studies that show that your plaque is going to get smaller by taking a statin. What has been shown is that statins will increase your plaque burden. In addition, I cannot get on board with the fact that heart attacks are occurring in these areas where there's plaque formation. What I can get on board with is that heart attacks occur in areas where there's a lot of turbulence. Where there's turbulence, there could be narrowing. Where there's turbulence, there could be a blood clot. Where there's turbulence, there could be inflammation. What is causing all of these things? Are you looking into the cause? Are you simply just agreeing to take the statin unknowingly that a statin over a 5 to 10 year period might add 5 to 7 days to your life? When you are risking side effects, whether it be as simple as muscle aches and pains, dizziness, high blood sugars, lack of CoQ10 or ubiquinone, the breakdown product, lack of vitamin K2, lack of the normal biologic process, a normal biologic pathway in your body, you're blocking that. A statin is an HMG-CoA reductase enzyme inhibitor. It's an inhibitor of this reductase, this enzyme that breaks down HMG. HMG leads to the production of cholesterol and other things like vitamin K, like CoQ10. That's called the mevalonate pathway. We need that mevalonate pathway. We need cholesterol. We're blocking it. We're causing neurodegenerative changes in our brain. MS, Parkinson's, dementia. These are common things in people who are taking statins. Could you be the lucky one and taking it for 25 years and not have a side effect? Absolutely. If you want to continue it, continue it. This is information purposes only. This is not medical advice. I'm not telling you what to do, but I want you to have enough information to make good decisions. We're not being provided with information. We, as doctors, we're not taking the time. We're seeing 40, 50 patients a day. It's not helpful. You're waiting for your pharmacist. If the doctor's seeing 40, 50 patients a day, the pharmacist is seeing multiples of that every single day, filling their prescriptions. We don't have time to answer the telephone. Yesterday, I called in a prescription for somebody because our system was down, and the pharmacist asked me, is there a reason why you're calling this in and not using the e-prescribing? And I said, yeah, our system is down. Okay, I was just wondering. She's overbooked. You could hear it in her voice. She was, just it sounded like she was overworked. But this is the story, okay? And if you've seen that reel, please share it. Please, send it to some friends or family. Send it to seniors. Send it to somebody that may benefit. But this is how we help others, is by spreading information. And, some of you might say it's a bunch of BS. That's fine. That's fine. You're taking them. You know people who've taken them and never had a problem. Praise the Lord that you don't have problems. But for the people who are having problems, and they were saying, I wondered why I was feeling so bad. Now you know. It's maybe not just statins. It's a bunch of medications. It's polypharmacy. Good morning, Dennis. Thank you for joining. Here's a good one. My A1C was 12.4, and it's now 5.8. And I want to thank you for all of the information that you have given me. Thank you, Dr. Jensen. Well, that's awesome. How many of you listening out there do not want to improve your 12.4 A1C to a 5.8? I don't know what medications you're taking, if any, but if you're listening to me and you did a carnivore diet, I'm guessing you don't need any medications and you reversed your diabetes that way. Lion says, my brother has been on a statin for 6 years and he's now showing signs of Parkinson's, and it makes you wonder. Lion, you have to wonder, is these neurodegenerative changes consistent with Parkinson's a result of being on your statin? I have to wonder. You guys, I'm going to have to pause for a second because Tootsie is out in the garage and now she wants in. She did not want to come in. So I'm just going to pause this. If you want to wait, I would appreciate you waiting. It'll just take me a few seconds. If you want to leave, I understand, but I have to take care of my little fur children, and she needs me right now. So please hold tight. I can't pause this, but I can just pause for a second, okay? Hi, I'm back. Look. Here, oh, that's her butt. I think she's trying to lay down. Oh, everybody. Oh, here she is. Everybody say hi to my Tootie girl. This is Tootsie. And she loves to be out in the garage until she doesn't. She loves the garage. Okay. You want to go lay down and be a good girl? Yeah. Okay. That's a good girl. Okay. All right. Lucy she's going to be taking a hike. So have a good hike. Stay safe. All right. I am back. We are talking about A1Cs. And this brings me to a point. that I want to comment on, especially since this particular question came from somebody who went from a 12.4 to a 5.8. You have to remember that an A1C is a diabetic measure. It's a diabetic measure of for diabetes, but it's a measure of glycation. So A1C or hemoglobin A1C, glycation means a sugar binding to a protein. In this case, sugar is binding to hemoglobin. So hemoglobin is the protein and sugar is glycating, but it only measures glucose. So glucose in this case is the sugar. So a hemoglobin A1C is the measure of glycated glucose. It doesn't measure any other sugar. It doesn't measure glycated fructose. That's a completely different test. So if a person is eating a lot of fruit, that's fructose and glucose, but it's not going to measure the fructose component of that fruit. So your A1C could be higher than it actually says. Okay? Now let's flip this around. You know that hemoglobin is carried in red blood cells. And it's these red blood cells with the hemoglobin that are getting glycated. Let's say that you are on a carnivore diet. It is possible that your red blood cells will last longer. They'll survive longer than 90 to 100 to 120 days. They're healthy, they're living longer. It's because of them living longer, they have more chance to be glycated. There is some sugar in your bloodstream. In fact, even on a carnivore diet, we have 5 grams of blood sugar floating around in our body, in our arteries, at any given time. This is normal, 5 grams. 1 teaspoon is 5 grams, 4 to 5 grams. 1 teaspoon of sugar is all that we need in our body in order to live a very vibrant life. If our red blood cells are surviving longer, they have an increased chance of being glycated, even by the sugar that's in your bloodstream naturally. So keep that in mind. If you are eating a carnivore diet and your A1C is 5.9 and you're worried your red blood cells could be lasting longer. Now, I would definitely run this by your physician. They may or may not know, but you need more blood work, okay? Get an insulin level, get a CMP, a complete metabolic profile, get a CBC, and please, by all means, get iron studies, and serum iron, and iron binding capacity, and iron saturation, a ferritin level, and a transferrin level. These are very important. It's important to get baseline labs. Let me see. Make sure I'm not missing any questions while I'm sitting here talking to you guys about A1C. Dennis says, what impact does statins have on your muscles? Well, how do I say this? In my 27 years, most people knew that statins could cause muscle aches and pains. Some would comment that they did have muscle aches and pains. But because the studies that the doctors were listening to showed that this was very rare, their comments were dismissed. So if a patient brought it up to me, because I was brainwashed into saying, hey, studies show that this is not very common, what you're experiencing is probably from you not working out enough and you're just out of shape, or you're working out too much, or something. I made up of an excuse for the patient, okay? You guys, doctors, they're not, I really think that we, in our time with patients, we're dismissing a lot of the things that they're saying and making them feel like they're ignorant, making them feel like they're dumb, making them feel like their symptoms don't matter or they're not really there. Like you must have some mental problem. But yes, statins affect our muscles. They can even cause rhabdomyolysis. But I have not seen that. But the destruction of the muscle, it goes deep. There's an increased risk of myostatin, especially as people age. Our muscles are aging. And so we have older people, as we age, we humans have more myostatin being produced. And myostatin actually causes breakdown, or it prevents muscle growth. So, there's got to be a really good reason to take a statin. If there is a positive, if you guys want to know a positive about, you guys, I am live on YouTube and Instagram right now. So please like and subscribe if you think that you're subscribed, and just check and make sure. But, here's a good one. I'm sorry, I can't pronounce the names here on your handles. I took my mother off of statins 2 months ago. She had numbness in her hands and pain in her legs. All of these symptoms have stopped. She is on Glucarin and having a carnivore diet. She feels great. You guys, this is a awesome story. Thank you for sharing. I see many of you are on Glucarin, and it works even better when it's on a carnivore diet. Glucarin is a nutraceutical. It is apolilactoferrin. So if you're familiar with lactoferrin, you are going to be as equally, if not more, intrigued by Glucarin because it is made with apolilactoferrin. The iron has been removed. This is why I am so adamant about people checking their iron studies. And it's important that we know our iron levels. Simply getting a hemoglobin isn't enough. Simply getting a ferritin level isn't enough. I saw a consultation yesterday where the hemoglobin looked a little high. It was a woman, and it looked a little high. The ferritin was very low. The transferrin looked like it could have been normal. The iron binding capacity, which correlates with transferrin, looked pretty normal. But a person who just got a ferritin level and it's low might be skewed into thinking that they're iron deficient, but their hemoglobin's high, their MCV is high, and their ferritin is low. That person has trapped iron, likely in their liver. Their hepcidin is likely elevated, and it's preventing the transport of iron from inside the cell to outside the cell where it can bind to ferritin. That person is not iron deficient. That person is iron overloaded. If you want more information on Glucarin, it's a nutraceutical. It is, if you want to talk to Dr. Christy Henderson at Metabolism IQ, talk to Peter, who owns Glucarin. If you're in Canada listening to me, talk to Baker Family Fitness, Krista. These are the people who have been trained and educated in the use of Glucarin. Some of you might just say, oh, it's just a supplement. Okay. It's a supplement then. And it has some amazing feedback from people all over the world taking this nutraceutical. It is not a supplement. A supplement, to me, supplements a really bad diet. A nutraceutical is like a bonus for a really good diet. A really good animal-based diet that's moderate amounts of protein, high in fat, and low or no carbohydrates. Most of the things that are causing our problems are caused by a carbohydrate-filled diet. Diabetes is carbohydrate toxicity, glucose toxicity. Do you continue to eat or consume a toxic carbohydrate, sugar, when you have diabetes, the very cause of your disease is the very thing you're eating, and you're going to continue to eat that. Some people will take medications instead of changing their diet. Some people will take Ozempic or Manjaro or Wegovy or Trulicity, these GLPs, just so they can continue eating the very foods that made them have the disease. Just eat less of them. But we don't know what it's doing to our body when we're consuming something in super physiologic doses. And then we take a statin to block the natural production of cholesterol because you've been told that cholesterol is a problem. I'll tell you that it's a problem if you don't have it. Your hormones are likely nil. You can't make vitamin D. You can't make your sex hormones, estrogen and testosterone. You can't make it without vitamin D without fat and cholesterol. These are the things that you're not being informed. How do you think our brain cells work? How do you think every cell in our body is formed? The membrane is made of cholesterol. If you didn't have cholesterol, you would fall like a heap on the floor. I've had people tell me, but my doctor told me I had familial hypercholesterolemia. You guys, I think it's a buzzword because I'm asking these people, did your doctor genetically test you for that or just give you that diagnosis? None of them have been genetically tested. It's a genetic disorder. It's not very common. And you're not dying from familial hypercholesterolemia. You're dying from the increased pleomorphism that's causing blood clots. It's the blood clots, you guys, that's causing heart attacks, not a buildup of cholesterol in your body. I have had 2 familial hypercholesterolemic patients. I genetically tested them. They were positive. I've had a lot of negatives. Only in patients who want to be checked because guess what? Insurance may not pay for it. And so you guys, don't let the doctor diagnose you with this without having a genetic test. I hope this helps. If you want to learn more about glucoferin, I would be happy to consult with you. I do not sell it. I'm not paid by them. I have a lot of patients who are on glucoferin. They are doing very well. I have 3 patients who have cancer who are doing very well with their cancer. They're not on chemo. They're taking glucoferin. I have diabetics who have reversed their diabetes, who changed their diet, who are exercising, who are on glucoferin. Do you have to be on glucoferin? No. To reverse your diabetes? No. What is it in a nutshell? I would describe it as breast milk in a capsule with trivalent chromium that binds heavy metals, that helps change body composition from a body that's overloaded with non-heme iron for decades. It's not your cholesterol. The sugar, the iron overload, the inflammation, the lack of sunlight, the too much blue light, not enough sleep, all of these things are adding to your demise. We are all going to die. But why speed it up? Why take these medications when we can reverse it with a diet? Why not exercise? Can exercise outrun your fork? Absolutely not. But people who exercise have better brain function. People who exercise have better heart function. People who exercise have better organ function in general. Their mood is better because they're getting better blood flow. Back to the thing with my dad and the 5 vessels that were blocked in his heart. He had collateral blood flow. How did he get that collateral blood flow? Exercise. Exercise drives blood flow. The collaterals were developing because the blood flow was pushing it into branches, trying to feed the muscle of the heart. It did a great job. My dad did not have a heart attack. He did not have an infarction. My dad went into VTAC. His electrical system, because of the plumbing system, got off. Remember, in our heart, we have a plumbing system, the arteries, and we have an electrical system, the electrical part of it. The SA node, the AV node. Everything can go bad. Medicines can disrupt this. Our diet can disrupt this. Over-exercise can disrupt it. No exercise can disrupt it. Yes, we're all going to die. Where are you going when you die? How are you treating this body, this temple, given to you as a free gift from the Lord above? How are you treating it? Are you mishandling it? Do you not care? Do you not respect it? These are a lot of, these are a lot of things that, we're not taking into consideration, and I want you guys to be more informed. Our diet needs to be an anti-inflammatory diet. The least inflammatory diet is an elimination diet of ruminant meat, salt, and water. Ruminant meat, salt, and water is the least inflammatory diet that you can eat. And the most inflammatory diet is that of raw plants. You eat raw plants, you're going to be inflamed. It's as simple as that. Let me make sure. Lion says, will a carnivore diet lower my iron binding capacity? That's a good question. A carnivore diet is full of, if you're eating animal meats that are rich in heme, so the ruminant meats, when the diet that I would suggest for you, Lion, is not only just a lion diet, which is ruminant meat, salt, and water, but it's the ruminant meats that make a difference. The ruminant meats are full of heme iron. So that's deer, bison, buffalo, sheep, lamb, elk. Those are the ruminant animals. And ruminant animals have multi-chambered stomachs. They are able to take the plants that they eat and make protein, make essential fatty acids. And then when we consume these animals, we are least likely to get the toxins from those plants. So eating a monochambered stomach animal like a chicken or a pig, we are going to take in everything they ate. So if they were, pasture raised, we're going to get a better quality food from them. We're also going to get higher amounts of omega-3. If we eat a grain-fed animal, their fat that we consume, now we are consuming their their linoleic acid. That's not good. Eating that much omega-6. So yes, I want you to eat an animal-based diet, but maybe if we're going to eat monogastric animals, look for those that that were grass-fed or organic. Okay, that's going to be a healthier animal. Will it change your iron binding capacity? There are not many things out there right now that is going to change your ability to bind tissue-laden non-heme iron. Non-heme iron comes from plants and fortified animals, fortified synthetic vitamins. We do get iron in our food, but it's heme iron from animals and non-heme iron from plants. People who eat a tremendous amount of plants or take synthetic vitamins and minerals will have an elevated non-heme iron, and they can get overloaded because we can't absorb and use non-heme iron. Only about 3% of non-heme iron can be used. About 30% of heme iron can be used. Heme iron from red meat, not from white meat. So the heme iron is needed for every cell in our body, just like we need iodine, just like we need cholesterol. Every cell needs iron. But what's happening is we're getting an overabundance of non-heme iron that's building up in our membranes of our cells, in your liver cells, in your eyeball cells, in your skin cells, in your kidney cells, in your heart cells. All of this non-heme iron is getting trapped. And people know about heavy metal toxicity. They're getting their blood levels checked or their hair checked for heavy metals. But what's being recommended to them is something like EDTA. And that chemical is, I can't recommend it. Does it work? It's possible it can work, yes. But the toxicity may be something I don't want to risk, or you might not want to risk. What does glucoferrin do? Because of the trivalent chromium, it does help to bind, sequester, and chelate iron in our body. Whereas EDTA is mainly just a chelator. So we need to know the difference, and it's something that you can easily look up, the difference between chelating, binding. Okay, there's a difference. Absorbing, there's a difference. And so when we have iron built up, especially in our liver, that is the main area where it's built up. The liver is a master organ. It's producing bile. It's producing cholesterol. If the liver is all messed up and trying to work when it's got non-heme iron overload, guess what? You're going to get a sluggish liver that's causing cholestasis, stasis, stoppage, or a pause, or not moving, sluggish. If you don't have bile salts, guess what? You're not making cholesterol. Guess what? You're not going to emulsify your fat. Guess what? You're not going to be able to make glutathione. And if your diet is really, really crappy, like no amino acids, no protein, you're just eating crapola, you're not going to get the essential amino acids that are needed to make like glutathione, like methionine or cysteine. We need amino acids, essential amino acids. We need to get them from our food. That's what essential means. Diet is really important, okay? If you're listening right now and you're a plant-based consumer, you've likely worked around that aspect of getting essential amino acids because you're mixing and matching foods like beans and rice to make a complete protein. But it's going to take a lot of beans and rice to get the amino acids that you need to make these functions in your body work appropriately. Carla asked, does glucoferrin require a prescription? It does not. You can buy it directly from glucoferrin.com. You can go to Metabolism IQ. You can .com. You can talk to Dr. Christie. If you're in Canada, you can get it from Baker Family Fitness, from Krista. And these people, they've been educated in glucoferrin, and they will help you with the appropriate dosing. That is not my specialty, although I am well versed. But again, I leave it to these people to help describe the benefits of glucoferrin and how it can help you. Where I fit in is I help people read their labs. That is my specialty. I am consulted by many of you listening to go over your labs, to go over your medications, to go over your medical history, and basically being that doc in your back pocket. Maybe your doc hasn't had the chance to go over all of your medications and look for interactions. Maybe you're doubled up on medications. Maybe you're taking medications and you don't need them. Maybe you don't even know why you're taking the medications and you want to know why. Maybe you want to hear about a diet. Maybe you want to hear about an exercise program. I had a question over here on YouTube, and I didn't skip over it. I just wanted to answer a couple of other questions, but it was in regards to a workout program by Mike Mentzer. And I am familiar with Mike Mentzer. He is an old-time bodybuilder, but I am not completely familiar with his workout program. I am sure that in my bodybuilding history, I have done many of Mike Mentzer's workout programs. I loved his posing routines. I studied his posing, and I thought he was a beautiful poser. I think there's a lot of beautiful posers in our day, Sean Ray and Victor Martinez, and they're just beautiful sculpted bodies posing. But you guys didn't ask that. Things that are bad gamer asked about, things that are rich in heme, that would be any red meat. Red meat is rich in heme. Are egg yolks rich in heme iron? No, they're actually more having non-heme iron, but not enough compared to vegetables and other plants that you're consuming. Even vitamins, you guys. There is no reason to be taking vitamins. Change your diet. The only reason to be taking vitamins is minerals is because your diet is crapola, to be perfectly honest, and it needs to be supplemented. Let's work on bonusing our carnivore diet or our keto diet, our ketogenic diet, which is either keto, ketovore, carnivore, lion. Those are the stages. Okay. Ruth, actually, she's helping me out here at Dr. Christy Henderson, blah, 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 at Dr. Christy Henderson. I believe she is also on YouTube and Facebook at Dr. Christy Henderson. Metabolic IQ. You can talk to her. She will help you with the dosing. A lot of times, Dr. Christy will send labs over to me to go over. She is very well versed in looking at your iron levels and looking at your iron studies. But we work in, I don't want to say collaboration, but I work with these people, and I know that they are intelligent to work with you guys. Again, if you're just wondering, hey, where are my labs at? Am I at risk? I can fit into that equation. Your doctor's not taking the time to go over it. Usually they have the nurse call you and say, hey, everything looks good, we'll see you in a year. No, they're not reading your labs correctly. I had to be trained in this. We did not get taught this. And if it was taught, it was superficially. I missed so many things. I have learned so much more in the last 4 years than I have ever learned in my previous 25 years of medical practice and residency. It's really a shame. But when we're seeing so many patients, we don't have time to do extracurricular reading, like how to read a lab test, like a CBC. What's it telling us? It all looks normal. No, it's not normal. Those are reference ranges. That is not normal ranges. You're comparing yourself to a bunch of sick people, you guys. Majority of people who go to a lab to get their blood drawn are sick. That's 90% of the population. Do you want to compare yourself with 90% of the population? Or do you want to know what your numbers mean? If you've been told that you're iron deficient, give me your labs. I want to go over them. You are likely not iron deficient. You do not have anemia. Anemia does not always mean iron deficiency. Anemia means you have iron dysregulation problem. Your iron is all in the wrong places and not where it can be used. We need iron, and you got it storing up and damaging cells in your body. What happens with iron when you put it in with oxygen and rainwater? It rusts. Well, do you think it's any different in our body where you have iron that's stuck in your cells and can't get out in the presence of oxygen and water? Our body's made of water. It has oxygen. Your body's rusting inside. You don't know it, but you do know it because those are your diseases. That's your insulin resistance and your diabetes and your fogginess and your cognitive decline and your depression and your anxiety and your kidney dysfunction and your high cholesterol. All of these things. What is high cholesterol anyway? Give me the definition. They moved the goalposts. Which goalpost are you gonna abide by? Looking at your iron. Don't simply look at your hemoglobin. You're rusting inside. You feel like crap. You're rusting, you're aging, you're glycating inside. You have oxidation and peroxidation going on. You're eating polyunsaturated fatty acids. You're consuming plants. You're breathing the air full of heavy metals and drinking the water full of fluoride. You're sitting on couches full of bromide. And you're wearing clothes full of bromide. It's a flame retardant. It blocks iodine uptake. You're low in iodine. You don't have a goiter, you just have enough iodine that's preventing a goiter, but you don't have enough for the cells to be healthy. There's so much, you guys. How do you convince my parents to get off of statins? They're 65, work out daily, but eat a typical healthy home-cooked diet and rely on meds. My mom is showing early signs of dementia now. Oh God, this is a great question. You see, is it loco? You guys, we hold doctors to elevated levels. We put them on a pedestal because we've been taught respect. Your parents respect your doctors. Like, why would your doctor ever lie to you? Maybe they're not lying to you. Maybe they just don't know. And so maybe because they hold their doctor to such high levels and high esteem, they can't see past what you're telling them. You're a family member. Your ideas just don't hold water to them, but their doctor does. So maybe you pass my stuff on to them. Maybe you let them read, you watch my reels, or someone like me. It doesn't have to be me. I would like it to be me. I would hope that I have the ability to teach somebody who wants to take care of their temple. They want to take care of their temple. They want to eat healthy. They want to exercise, but yet they're putting a chemical in their body that they don't need. Why do they need it? Maybe you need to purchase a consultation with me for them. Maybe it's a Christmas present or a birthday present, and they just go over things with me. Maybe that's an idea. A consultation with a doctor, a family practice doctor, DOMD, not one of those where they think that they're just quacks, which I don't think they are. But that's another story, okay? But you see, if you don't have MD or DO behind your name, to some people like your parents, you have no credibility. Don't be talking to your chiropractor. Don't give me your chiropractor information. I don't want that stuff. As the chiropractor is trying to get everybody off of medications. In addition, they're probably trying to put you on a whole bunch of crappy supplements that you don't need because you have a crappy diet that they're not talking about. If you want to have a doc in your back pocket and you want me available, join my membership. It's $100 for the whole year. And sporadically, if you have questions and you need to run stuff by me, text me. If it's more extensive and it's going to require something like a consultation, I'll let you know. I've never had anybody abuse me with a bunch of questions, maybe a couple. I've never really had people abuse me with questions that they couldn't just look up on ChatGPT. But sometimes we just need that support system of another doctor with different ideas. This is important to some people. Get them a membership, okay? Dan says, eat herring for omega-3s. Fish is a great source. Make sure it's wild caught fish for omega-3. Get grass-fed animals. If you're going to eat animals, try to get grass-fed organic meat if you can. They're going to be richer in omega-3s. Same with your eggs. A pasture-raised egg is going to be higher in omega-3s than the ones that are just grain-fed. They're going to be very low in omega-3s. Omega-3s are essential fatty acids. So are omega-6. We need omega-6. Even though you hear all of this bad stuff about omega-6, omega-6 are needed for our body. They are essential. We have essential fatty acids. We have essential amino acids. We do not have essential carbohydrates. There are no essential sugars. None. Zero. So getting enough omega-3 is important. Grass-fed animals, pasture-raised animals, good sources of wild-caught fish, fatty fish, wild-caught, will supply omega-3s. Omega-6 linoleic acid in high doses is what our problem is. We're getting a ratio of omega-6 to omega-3 where it should be 1-to-1. We're upwards to 20-to-1, 29-to-1. This is what's causing so much inflammation. Where are we getting all of the linoleic acid, the omega-6 in our diet? It's from polyunsaturated fatty acids in processed foods. Are omega-6 in animal meats? Yes, only in the right amounts. But we are not just consuming animals. 90% of the population is consuming processed foods. Pasta, rice, cereal, all of that is processed and fortified with high amounts of non-heme iron that's getting trapped in our cells, causing a sluggish liver, causing a sluggish brain, causing sluggish kidneys. We're getting organ damage from non-heme iron from fortified foods. We're eating too many polyunsaturated fatty acids, omega-6, causing a disturbance in our ratio. The amount of, you can't eat enough omega-3s to balance this out. You need to lower this. No, do not take synthetic omega-3. It's rancid by the time you get it. Eat real food, high in omega-3s, grass-fed meat, pasture-raised eggs, wild-caught fatty fish. Okay? Great question. Midwest Ribeye, that is a very good question. Midwest Ribeye asks, would pasture eggs, my own free-range hens, have better ratio of heme to non-heme iron than store-bought? It's Midwest Ribeye. It's not so much the heme versus non-heme as much as it's the omega-3 content in your eggs versus store-bought eggs. If you're feeding, you can have, Midwest Ribeye, I do not know you, but your pasture-raised eggs they should be eating on the pasture. We should not be giving a pasture-raised eggs grain. Grain is polyunsaturated fatty acids. They're full of PUFAs. If we're giving our hens, our chickens, polyunsaturated fatty acids, their eggs are going to be full of them. Okay? Their meat is going to be full of them. The only thing that my dad did right was he actually boiled his chicken because we were getting store-bought chicken, and that's full of omega-6. So at least we had less omega-6. But then again, he turned around and ate sugar-free crappy ice cream with bran flakes, rice, pasta, and other cereals. I mean, you just can't win, but we didn't know. I didn't know as much then as I do now. I can't have regrets. Coulda, shoulda, wouldas aren't going to help me. I have to move forward, and all of you guys do too. If you're taking care of your parents or your parents are already deceased and you say, gosh, if I would have known. All of us have said that about something in our past. We didn't know, and now we know. And we're going to get smarter. We're going to gain more knowledge. We're going to have more information. We're going to be able to make better decisions. So Midwest Ribeye, I don't know so much about the non-heme iron versus heme iron, but the yolk is where non-heme iron is, but it is not enough. That is going to cause problems. We need, this all kinds of iron. The glucarin can help to convert some of the non-heme iron to heme iron. So that is a possibility. Glucarin has a lot of possibilities. I think a good amount of education on this particular nutraceutical would be in everybody's best interest. Oh, this is a good. Michelle asks, how much non-heme iron do you absorb from cast iron pan? It's going to depend on the quality of your cast iron pan. But, I've gone away from cast iron pans because I know the consequences of non-heme iron, which cast iron pans have. And so if we're eating from you're cooking in a low quality, or how do we know what the quality is? How do we really know what the quality of our cast iron pan is? I don't want to even take the chance. So I got away from cast iron. I'm using stainless steel. I was using an awesome pan from Ancestral, Black Pearl Ancestral pans. And it was awesome, but mine started to be porous and leak, and I haven't really looked into getting another one. Justin says, I pushed back against my own doctor last week about some medications, and she finally researched and agreed that I was not feeling well. Justin, awesome. That's the way to be brave. You stopped taking those medications because they were causing problems. But the best part of it, you discussed it with your doctor. Just willy-nilly stopping your medications because you heard from somebody, even if it's me online, don't stop your medications willy-nilly. Talk to your primary care physician. Talk to the cardiologist. Before you stop something, say, hey, here's my concerns. Here's my questions. I've been reading about this. I've been learning more about this, and I don't think I need this. Is it okay if I stop? Get their blessing or not blessing. But Justin just helped their doctor gain more information. That is amazing. That's what happened with me. Justin, that was my story. A Justin came in, not that Justin, but a Justin, I'm making that name up, but a patient came in and said, Dr. Jensen, I think you're wrong about some things. Please read this. Please hear me talk to you. I'm not going to do this particular medication, and here's why. Educate me. I'm not beyond higher education. I need to be educated. Doctors do not know it all. We have extensive training and education in a facility, in an institute. Does that mean it's the correct information? No. I believe that I learned a bunch of buffoonery in my past. And if it wasn't for the Justins of the world who loved me enough to help me not make future mistakes, I owe a lot to those patients who came in and said, please listen to me. I think you're all wrong. Read this. Listen to this doctor here. Read this book. I had a patient bring me in 7 books. I read them. I had so many regrets when I got done reading those books. I spent months apologizing to my patients because I harassed them. Not really, but I strongly persuaded them to take their medications. It was a mistake, but I didn't know. But you know what? Doctors can't claim that they didn't know because they're held at a higher standard. You can't use that in a court of law. I didn't know. No, it's not going to work. That's negligence. So we need to be very careful, and try to help your doctors. Justin, thank you so much. I appreciate that. JP says, don't eat wild-caught fish. It's too high in parasites. I would never recommend eating your fish raw. JP would rather eat a raw cow. Well, so would I, JP. Agree. I would rather eat raw meat than eat any fish whatsoever. It's full of heavy metals, but I'm giving you options of where you can get omega-3s. There are some people that will not, JP, there are people, them, they won't eat cattle or deer or any ruminant meats, and what they will eat is fish. We gotta help them and give them choices. A wild-caught fish is gonna be better than a farm-raised fish that's fed corn and in a pen like this. Do you know how many fish they get in their pen and they just throw corn in there and feed them? It is a disgrace. Go to a fish farm. You want to talk about inhumane practice? How sad. It's just sad. Oh, thanks, JP. That's very kind of you. Bye-bye. If you would have just listened a little bit longer, that's what the YouTube, I might just stick over here. Let me see. Lara says, I've been, did I miss something? Oh, Lara says, I no longer use iron skillets, had extra iron testing done that Dr. Jensen taught me to ask my doctor for. I was shocked. I've been ketovore, couldn't believe the high ferritin levels. Yeah, you guys get your iron studies checked. Lara is living proof that she had underlying iron overload and didn't know it. Dennis says, cook in a good multi-layer stainless steel cookware like Made In. Good. Thank you for the recommendation, Dennis. I appreciate that. Marnie says, can coffee interfere with mineral absorption? Yes. Coffee's a plant. Coffees have tannins and phytates and oxalates. And yes, they can interfere with absorption of calcium and magnesium and zinc and selenium and amino acids. Yeah, any plant with oxalates can have this problem. Leaves of the plants are much worse, so tea's much worse than coffee, but coffee can do these things. And so yes, if you're struggling with leg cramps at night and you feel like you might be low in magnesium, get a magnesium level. And maybe you stop drinking coffee. Maybe your magnesium is low because of the coffee. Maybe your magnesium is low because you're eating too much salt. Too much salt will deplete your potassium. Potassium and low magnesium all go together. There's so many things that we need to, we need to consider. I know that you guys are not doctors. You don't have this information at your fingertips, but we can Google these things. Hey, my magnesium is low, my potassium is high or low, I guess it would be in this case. My sodium is high, my water is low, I'm having leg cramps. Type them all in. See what's going on. Kathy says, I just looked at my husband's blood work. He's on medications for thyroid, blood pressure, asthma, and she wanted him on cholesterol, but he doesn't take it. She doesn't do any iron tests. Kathy, get in. If you guys need if your doctor will not order your labs, contact me, email me, or message me through Instagram, YouTube, Facebook, Rumble, Twitter. You can email me at IronLadyDoc@AOL or message me through the other platforms. I can order your labs. The unfortunate thing is your insurance will not pay for it. So, but it's a way. Your doctor's not doing it. Ask someone like myself. I'll order them and you can find out. You don't have to consult with me. I don't require you to consult with me to have me order your labs. If you have somebody else who wants to look at your labs or you just want to do it yourself and save the money, do it. If you have a question, you want to consult with me, I'm here for you. But if you can't get somebody to order your labs, I can get a discount. Can you order them yourself like at lifeextensionlabs.com? Absolutely. You might get a better deal through me because I get a discount because I'm a physician or a provider. And I would be happy to pass that discount on to you. I'm not doing it to make something from you. So I'm not requiring a consultation. Okay? Just to be perfectly clear on that. But I would be happy. IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Dennis says you will find more chiropractors on board with Carnivore. I agree. I'm finding more and more. Lori Miller says omega-3, 6, 5, 7, 9. We need all of them. You need essential fatty acids. Essential fatty acids, we need them in order to our body to work. Okay? But we're getting too much of some. All right? Let's see. Make sure. There's a lot of messages that are being removed over on YouTube. I am live on YouTube and Instagram. Lori asks, what nutraceutical did you just mention? Glucarin. Glucarin, Glucoferrin, a nutraceutical that is, honestly, Lori, it's making waves in the world. There are Brazilians, there are Australians, there are Indonesians. They are taking Glucarin. Glucarin is made in the United States. It's made in the United States. It's engineered in California, and it's packaged in California and sold out of Arizona. I believe it's making waves because it's educating people on the truth behind iron overload. And we've been told that the only way you can have iron overload is if you have hereditary hemochromatosis. That is not true. Yes, you can have hemochromatosis. That's hereditary. But people have iron overload leading to hemochromatosis, leading to ferroptosis, leading to cirrhosis simply by consuming non-heme iron in excess. And it's building up in our tissues as we speak. It cannot be removed with a carnivore diet. It cannot be removed with a vegan diet. In fact, it's going to be built up even more. It cannot be removed with exercise. It's trapped. It's trapped for good reason, but it's causing rusting in your body. And so if taking a nutraceutical like Glucarin without side effects can help bind that iron, get a baseline iron studies. If you don't believe me, get a baseline of your iron studies. Start the Glucarin and recheck in 4 months. See if your numbers are changing. See if you feel better. It's, I would rather drink or eat or take in a capsule of breast milk than I would a pharmaceutical chemical that blocks normal biologic and physiologic pathways in my body. Taking Glucarin is adding to my normal biologic and physiologic system. It's the exact things that my body needed when I was an infant breastfeeding. Unfortunately, I was not breastfed. I was formula fed. Formula is full of toxic levels of non-heme iron. I had buildup of non-heme iron since day one out of the hospital being formula fed. It's fortified with crap. It's not breast milk. They'll tell you it's an alternative. It's not a very good one. And then when my mom got done formula feeding me, she fed me full of jar food, plants, non-heme iron, crap. How do we get by? I know you're going to have some people say, I couldn't breastfeed and this is the only option I had. No, it's not. No, it's not. Do you think that your ancestors, before the development in the early 1900s, before formula was made, did you think that, you know what, I guess I can't breastfeed, so I guess my baby's just going to die? No. You started chewing up your meat and your eggs and you put it in your baby's mouth. I mean, we would not have a population if we relied that long ago on formula. Think logically, you guys. And I get these hate things like, you're being mean. I adopted a baby and I can't formula feed. Chew up your food and put it in their mouth. You can do that. Put it in a blender. Are you afraid of their choking? Put it in a blender. Puree it. You're going to rely on, the only option you have is formula. That's craziness. You just don't want to do it. You actually believe that formula is good for their baby. Do you know how much sugar's in it? You're causing diabetes and fatty liver disease right from the start, right out of the gate, right out of the delivery womb. I'm sorry, I get passionate about this because the excuses I hear without people really knowing what's going on. Marnie says, I know I need some salt in my diet, but I'm never sure how much exactly. Marnie, I think you should salt to taste, and that's it. I don't think that we need to overconsume water, and I don't think we need to overconsume salt. There are people out there who don't eat any salt. They are basically eating ruminant meat and drinking water. Salt became a way to preserve meats. I don't think we should be afraid of salt. We should be afraid of manufactured salt, iodized, bleached, chemical-laden salt, I do believe, but mineral salts. Before, you see, when we were drinking water out of a stream, and every time the water would run past a rock, we would get minerals, and we would drink that water, but we can't drink the water now that's in a stream or a river. So we need to consume the salts that have those things in it, the minerals that we need. If the animal that we're consuming has these, great. Usually if we're eating a pasture-raised animal, they will have what we need. Okay? Lara says, if you're not eating processed foods, then you really can't have too much salt. Your body will get rid of what you don't need. Lara pours salt in hand and drinks it back with water. It's like a little shot, right? A little chaser. Keep small amounts of salt in containers. You know, what I did when I first went carnivore and I was incorporating fasting, I was getting hungry. And so what I found, and I learned this from another carnivore doctor, is that putting just a little bit of butter in my mouth with some salt, that really kept me going. Remember, butter is full of beta hydroxybutyrate. It's a ketone, and it supplies energy. It's very, very good. So butter is good for us. Animal foods are good for us. Kathy says, glucoferin is saving my life. Thanks to Iron Lady, Naturally Connected, and Glucoferin, which is from Mr. Glucoferin. Kathy thank you for your kind words, Kathy, but it's also you. You've changed your diet and you've added Glucoferin. Yes, it's changed your life, but you made a whole bunch of changes. And Kathy thank you for your testimony, because this helps others listening right now about learning about Glucoferin. If you want to know about Glucoferin, go to glucoferin.com. Order directly from that site, or go to Dr. Christy Henderson, Metabolism IQ, or in Canada, go to Baker Family Fitness, or Naturally Connected. I don't know if I'm guessing Naturally Connected also sells Glucoferin. I do not know. I've read some of his stuff. He does blogs. He's learning, just like all of us. We're learning about iron, and we're learning about iron overload. We're learning about oxidation, and we're learning about rusting. We're learning all these things that we were never taught. It's logical, but we're not using logic. Doctors didn't use logic. We were brainwashed. We were fed what they wanted us to know, and then we regurgitate it out to you guys. And so I have to empty out all of those experiences, all of those things, use a little bit, right? And then add in new experiences. There are doctors out there that I think are brilliant. They're talking about the heart and the pump and the arteries, and they're talking about electromagnetics, and they're talking about natural water in our body. They're talking about these things. You guys, if you think it's hocus pocus, I'm going to have to disagree. These things are real. We have to know that God made our body perfect, and we are messing it up with the fake food we're putting in it. And I believe that we are being poisoned in our air with heavy metals and glyphosate. The reason we're having to use glyphosate is because we have no topsoil. We are monocropping. We are destroying our soil, and we're destroying the microenvironment, the biome, the animals that live in there, and then the animals that eat the animals that live in there. By monocropping, we're tilling over and over and washing off what used to be 6 inches, feet. Back in the day, topsoil was this big, feet. And now it's not even 1/8 of an inch. That's why we get weeds in our crops. And that's why we spray with glyphosate. And then we spray even more to dry out that crop really, really fast. And you're eating the soy, and you're eating the corn, and you're eating all of the products made with those things. Those are polyunsaturated fats. And they oxidize with iron, with oxygen, with hydroxyl groups. All of these things are causing oxidation in our body, and we're wondering why we're tired and have brain fog and dizzy and falling. We're adding in chemicals that are adding to all the oxidation and the rusting going on in our body. And, I had a question earlier. It says, can I take berberine instead of my metformin? Of course you can. Of course. Is it any better? You're going to substitute a less concentrated berberine, which is a plant, instead of metformin? Why do you need metformin or berberine in the first place? Because your sugars are too high. You have a disease of carbohydrate toxicity. Instead of adding berberine or metformin, quit the sugar. Stop the carbs. Stop the toxicity that caused your disease. Don't take, and I don't want you to take a pill. It's a supplement, berberine. It was made from a plant with side effects. Metformin with human side effects. It was made by a human. It's going to have side effects. All medications have side effects. All of them. Because they're blocking normal biologic processes in our body. If a farm rep came up to you and said, our drug is free of side effects, you better run the other way. What, you mean less side effects than your competitor? Yeah, but the alternative is just to let them die of their diabetes. Well, why not educate them on what diabetes is? What the disease is caused by? If you take away the alcoholic, is the alcoholic still an alcoholic without the alcohol? We need to start using logic, you guys. Some of you, I know, don't want to change your mind. That's why you were given freedom freedom of choice from God. You were given freedom to make your own choices. You are not only affecting you, but you're also affecting those around you. The fact that you are using the healthcare system affects everybody around you. But if you don't want to listen to the advice and you want to continue eating the toxic food, fake food that causes your diabetes, you have free will. I say go for it. Lisa asks, is there a link with copper deficiency? I don't know what a link with what and copper deficiency. We are, the more and more educated you guys get, the more and more extraneous people are going to try to insert ideas into your brain that we have copper toxicity or we have iodine. You don't really have iodine problem and you don't need to take iodine. There are a lot going on right now to try to confuse you because they're getting scared. The powers that be that want you to continue eating the way you do are going to scare you. Don't take iodine. It's going to cause Hashimoto's thyroiditis. Don't eat vitamin A. Don't eat liver because you're going to get vitamin A toxicity. And then you're going to get copper deficiency. And then you're going to on and on and on, you guys. And they're going to get you confused. And then you're going to start taking more and more supplements. Eat head to tail when you are hungry. Stop eating and eat again when you're hungry. You will get all of the nutrition. Even if you told me that you had to buy store-bought animal products, it's better than the alternative. Okay? A lion out in the wilderness doesn't say, uh-oh, that's too much liver consumed. I better stop and start eating muscle. They will just eat until they're comfortably full, and they usually actually start with the organs first and then eat the muscle because most of the nutrients are in the organs. All right. Lara says, Kathy, that is awesome. So happy for you. You're welcome. Lori Miller says, is there, and I know it's Lori Miller Burns, but that took too long. So maybe I should say Lori Burns. Is there a brand maker of Glucarin? Glucarin himself. It is the only one. Do not buy on Amazon. Glucarin, Dr. Peter Slowinski, he's Polish, he's from Poland. He made glucarin. It has a patent. So go to glucarin.com or buy from the people who work for, I don't want to say work for him, who are sellers of the glucarin. Okay? Not everybody works for Dr. Slowinski, but he has people who sell his product. That's Baker Family Fitness. That's the Naturally Connected guy. That's Dr. Christy Henderson. I don't know who else sells it. Those are just three that I know. And in fact, I don't even really know the Naturally Connected guy. I just read his stuff. I do not know him personally. I know Dr. Christy. I know Krista from Baker Family Fitness. I know them personally. I trust them. If they don't know an answer, they contact me or they contact Dr. Peter Slowinski. Not that I know all the answers, but we run things by each other and we're studying together and we're trying to figure these things out. Okay? We're trying to help you. Help yourself. But taking some knockoff brand of glucarin, I do not recommend. If you don't want to take glucarin, do not take glucarin. I'm not trying to sell you anything. I'm just trying to provide you with information. If there wasn't a product out there that could bind iron, I would say, boy, I wish there was a product out there that could bind, sequester, and chelate iron. How do you know if this is it? Get your labs checked and then recheck them in 3 to 4 months and see. Kathy, Lara, I don't know who else. Raise your hand. Who else is taking glucarin and has changed their blood composition? Who's made their red blood cells healthier? Who's improved their brain function? They're not foggy. Who's improved their blood sugar levels? All of these things are a result of getting excess built up tissue-laden iron out of your body. We cannot use it. Okay, Lara agrees, only buy glucarin from @glucarin. The copied stuff or the made up stuff, it's on Amazon. I can't trust them. I don't think that they went as extensively as Dr. Peter Slowinski, studying it for 30 years and getting a patent for 15 years. I don't think those other guys are going to match up to him and his knowledge. If you have ever listened to Dr. Peter, Piotr, I know he's Polish. It is easier for the American to say Peter. Are we slanging his name? Yes, I am using slang when I call him Peter. I apologize to him right now if he's listening. But yeah, I know it, Piotr, I get it. Piotr, it's so hard for the American to get out. It's almost like it takes energy to say your name, and I apologize if I slang it, but you can call me Iron Lady and I'll be happy with it, okay? The Iron Lady Doc. Lori says, I can recommend Weston Price Foundation enough. They guide on breastfeeding and natural alternatives if you can't breastfeed. Such great education. Dennis says, interesting. I salt heavily in my water and on my meat. Take a but Dennis, if you didn't take the magnesium, you might end up being low in magnesium because of the over salt and under potassium. Remember, high salt lowers potassium. Low potassium lowers magnesium. Low magnesium lowers potassium. It all goes together. Why are we taking all of this stuff when we may not need it? I'm trying to keep you guys free of adding in all of this stuff. You could be taking a magnesium supplement because your magnesium is low because your sodium is too high. Just some things to think about. Lara says, Dr. Slowinski is the original creator of @glucarin. All the rest are imitators. Good. I don't think Lara doesn't work for Dr. Slowinski. She's not being paid off by him either. That I know of. I don't think she's a plant. Janet says, I blend meat, add eggs for my mom who has Alzheimer's and stopped using her dentures. Great. That is an excellent idea. You do not need, there was something funny. You guys need to watch this. You need to go over, and I don't work for Dr. Ken Berry. He doesn't even know me from Adam or Eve. None of them. He does not know me. But he did this video yesterday, day before, I don't know, or this week sometime. He did a video on how many times we should actually be chewing. There were people in the past that told you should chew your food every bite 100 times. And somebody commented and said, If I chewed my food 100 times, the people at my family table would have eaten all my food and I would have only gotten one bite. Then there was people that came around and said, you should chew it for 30. You know what Dr. Berry says? Chew it so it's safe enough to swallow it and not choke. But you don't need teeth. Evidence. Janet feeds her mom ground beef, blended, and yolks. And she's feeding her mom the most densest, most nutritional food that she could ever give her mom. And her mom, likely, if we're giving her mom enough fat, give her some MCT. It's about the only fat I might recommend from a plant is MCT oil. Give her some MCT oil. Increase her saturated fat 2 to 1 and see if your Alzheimer's mom doesn't pop out of it, snap out of her dementia. Start talking to you, start remembering things. That is an amazing story. Get omega-3 rich eggs that are grass-fed, pasture-raised eggs. Eat the meat on the pasture. You know what? You only got a short amount of time with your mom. Get it done. Get it done. Start doing it. She needs fat. Lara says, Dr. Kiltz at Dr. D-O-C-T-O-R, if you guys are just listening and can't read, is a big proponent of not having a lot of water nor any supplements, like Dr. Jensen has said. Go to Dr. Kiltz. If you think I don't even listen to Dr. Kiltz. I know him. I watch his stuff when he's on interviews. I like his stuff. He's an infertility specialist. He's a gynecologist. Okay? He's got, if you want to listen to him every single morning, I believe it's 5 a.m. Central, he does live streams. Every morning. I used to watch it until I had to start doing my own. I didn't have to. I chose to. I want to do this. You ask me why I'm doing it for free? Because I want to help you. You're going to help pay me back in time. You will help me survive. I know you will. I've had so many people thank me. I've had so many people tell me thanks for letting Divine _Carnivore, do my dad's story. That was her. She asked me. She read something that I posted and said, can I do your story? How amazing and honorable. I even sent her pictures of my dad so she could get kind of a look-alike. It's his story. My dad was a runner. Maybe he shouldn't have been running. Maybe we should have stuck to just weightlifting. Maybe his mTOR was too high. Maybe all the sugar and the carbs and the bran flakes because he needed the fiber and the sugar-free alcohols that he was consuming in the sugar-free ice cream. And what about the medicines all combined? What if my dad was a painter? What if it was the fumes? What if it was heavy metals? I never checked my dad's iron level. He was eating non-heme iron, all the vegetables, the lettuce, the spinach, all of it. He was consuming all of it. Is it just the statins? No. It's not just the statins, but it's a combination. Why would we put something in our body that we don't need? Because we were told wrong. All of this centered around, all of it goes back. One big giant core. Mr. Jensen, we just got your cholesterol and your level is high. Take this medicine, statin. Stop eating red meat. Do you know that made me feel horrible? I wanted red meat. I loved grilled burgers. Dad, are you sure? Can you just make them for me? No, I don't want you to live my path. I got coronary artery disease maybe. We don't know. It all started with that wellness visit. Mr. Jensen, your cholesterol's too high. We're going to have to treat it to prevent a heart attack. Oh, we treated it all right. Did he still have heart problems? Did he still get 5-vessel disease even though he was on the statin for 20 years? Yes. It probably increased his calcium score. It increases plaque. And you know what your doctor will say? It's stabilized. At least it's stabilized calcification. Oh my gosh. Do you even know what you're saying? Do you even know what is causing a heart attack? Well, maybe back then, okay, so that's 30, 40 years ago. Okay, we'll give them a little grace, right? They didn't know. But what about now? We have so many doctors coming out with the truth. Malcolm Kendrick, Dr. David Diamond, Lustwig. I could go Ovadia, Dr. Malhotra. How can we have so many people? Dr. Stephen Hussey, a chiropractor, the ones you guys don't believe in. I don't believe in those chiropractors. He had a heart attack. He's studying this stuff for you. He's talking about how the heart pumps or lack thereof. We're treating it all wrong. We're giving the wrong advice. If you want to turn me off, turn me off. But you're going to have to turn off all of these other doctors too. You're going to have to turn off Dr. Ken Berry with 3 million followers, 3.5 million followers. You're going to have to turn off some of Dr. Berg's stuff because he shares the same evidence. He's a chiropractor though, so I better wash your hands of him. Wash your hands of me. I don't care. It doesn't bother me. I could help one person. I could help Lara. I could help Kathy Grant. I feel good about that. Janet says, oh, and I top her off with glucarin. Janet, that just added to it. Top it off. Open the capsule, pour out the stuff. It's the cherry on top. That is beautiful. You guys probably read her comment before I did, but I'm just getting to it. That's beautiful, Janet. Thank you for sharing that. I do not work for Glucarin. There's no pay involved. I do not sell Glucarin. There's a reason for that. I want to just share information to you. Then you guys make a decision. If I made money off of selling you Glucarin, do you not think that I would try to get everybody on Glucarin? But if I have no financial, it's not public, it's not on a public trading, I don't have stocks in Glucarin, I'm not selling you anything. These are real people commenting. I didn't even know. It made me giggle just knowing that wow. Lisa Fit, definitely poisoned in the air. Absolutely. It's spraying in the air. If you think that it's not, look up. Look up. Those are not just any old jet streams in the air. If you go by a field and you see dust in the fields, that is full of poison. That is glyphosate. If a farmer tells you they're not using glyphosate or something similar, even worse, I can't remember the name. I think it starts with an A or a C. I cannot remember. Those farmers are lying to you. It's spraying in the air. Do you think it's only on the crops? No, it's in the air. We're breathing it in. We're breathing it in. It's in our water. Do you think your city water company is taking the glyphosate out? Oh, they got many filters, Dr. Jensen. You know what? Ours just got turned down, our water. They told us we couldn't sprinkle anymore because we had too much nitrates in our water. Give me a break. Do you know who they shut down? They shut down all of the residential people sprinkling their lawns to get green grass. Did they tell the farmers to stop spraying their fields? No, absolutely not. Because we live in Iowa and we are a monocropping state and we need it. But the city water company will get back at the residents. They're going to pay for their taxes anyway. But I'm not going to have them water their lawn. I don't want them to have green grass. It's all of them. They water too much and all of the nitrates from their fertilizer because they want to take care of their lawn. Really? Really? Did you talk to the farmer? No. Because you make money off of your farmers. You don't make as much money off of the residential trying to keep a nice lawn to make their house look nice, that they feel joy for. Dennis says, how much liver to grind? I just do half and half. If I got a pound or a half to one. If I got a pound of ground beef, I use a half a pound of liver. It's just me. I like the taste, but maybe a quarter. Maybe you don't need that much. Maybe just a half a pound of liver to 3 pounds of ground beef. Okay. All right. Oh, Lisa says, I heard someone saying iron deficiency is actually copper deficient. Now, you either have one or the other, okay? Heavy metals are so related. Lisa, this is a good question. I would really have to look this up. Another person that I have not mentioned is Richard. Oh gosh, help me, you guys. He's Australian. Is it Richard Smith? Oh my goodness, I can't believe And I'm watching his stuff. You know, when you're live like this, a lot of times you get so foggy. But Richard, and he's always on with Stephen, Stephen Thomas. I believe it's Stephen Thomas. They're in Australia. Lisa, oh my gosh, you please go to him and watch his stuff. Oh, Richard is so very smart. You think Ben Bickman is smart? I think Richard is heads and tails above Ben Bickman. I am not putting, Ben Bickman is brilliant on most things. Richard, you want to talk about iron? Is he on board yet? I said yet. With iron overload, with non-heme iron in tissues? I don't think yet. He is going to get there. And I am going to help him. I'm going to send him stuff. I want to try to collaborate with him. I'm not trying to make from him. I just think he's brilliant. But he's going to get this. And he knows about copper and magnesium and ceruloplasm and all of these things, Lisa. He's brilliant. He's brilliant. Okay, Kathy says Naturally Connected does not sell it. He recommends it. Good to know. Dennis is taking glucoferin and anxious to see his upcoming labs. Awesome. Kathy says, yes, get glucoferin from Peter at glucoferin only. Good. And other benefits? Lori Burns. There are so many benefits of glucoferin that I can't even, if you got a problem, it'll help it. Iron, because iron is the problem. Iron toxicity in our cells and tissues is the problem. So can glucoferin help everything? Yes, because you're removing the iron. You're chelating and binding it and sequestering it, getting it out of our system. We got too much. And so to say, will glucoferin help your rash? Yes. Will it help your eyeballs? Yes. Will it help you breathe better? Your lungs? Yes. Will it help blood flow to your big toe? Yes. Will it help your nails grow? Yes. Will it help your breasts get bigger? Yes. What can't it do? It's all about the iron overload. It's about iron dysregulation. We got iron all in the wrong places, you guys. It's all in the wrong places. Lara says, Dennis, please understand you're taking glucoferin, then know that your labs will not show changes for quite a few months. At least 120 days. Lara, I believe Dennis has been without labs for 6 months. So just for your own knowledge. What was this? Hold on. I missed this one. Something about the 4. I hear you. Oh my gosh. I just missed it. See if I put my finger on the thing. Oh, there we go. Melanie says, haha, I hear you. With 5 siblings, it was survival of the fittest at the dinner table growing up. That's very cute. That's very cute. Labs to get. Ferritin, iron, liver enzymes. So get a complete metabolic profile. Fasting insulin, A1C, CBC. Get a CMP, a free T3, a free T4, a TSH, a TG, a TPO. These are all the labs you need to get. If you put rewind, go back. But you need to get a lipid panel probably. Okay, a CBC, a CMP that has all your liver and your kidney function on it, your electrolytes. Get a fasting insulin level, get an A1C, get a free T3, a free T4, get a TG and a TSH, get a TPO, and get your iron studies, and a serum iron, a transferrin, a ferritin, a TIBC. Get these labs, get a baseline. There she goes. There goes Lara. TSH, TPO, TG, reverse T3, ferritin, transferrin. She's writing them all down. And a protein S. Ooh, a protein S. Get a protein S level. You know, protein S is going to be very suspicious looking when all of this stuff on COVID comes out. Lara says, your doctor will push back on the question, why do you want this test? I have to give a reason. Tell them the reason. Tell them a reason. I want it. You work for me. I'm paying insurance. I won't get it. Then if they don't get it, say, Dr. Jensen, order my labs. I'm willing to pay the price. Yep, Dennis says, yep, Lara, I've been on glucoferin for over 6 months per Peter. I have been taking double dose. Well, double dose for hypergenic, but double dose for somebody else might be something different. It's all dependent. That's why you want to ask Dr. Christie, ask Peter, ask Connected, the Connected guy. Ask me. I'll tell you what dose you should be on. Okay? Let me look at your labs. Let's do a consultation. Lara takes 4 capsules a day, kind of costly, but how much will you spend on healing? Absolutely. We're in the business of preventing and reversing diseases right now. You've been eating a bunch of crap and smelling the air and drinking the water. It's worth it. Spend a little money now for your health. I think a maintenance after you've treated your iron to respectable levels, that I think a maintenance of 2 caps forever is in your best interest until I know something different. Again, I'm not financially incentivized by anything about glucoferrin. This has been a great conversation, though. I love it. Lara's been taking glucoferrin since September of 2024. That's when I started, Lara. But my iron levels were very high. Going to take a while to heal. Absolutely. It could take a year, right, Lara? Or more. If we continue to eat and drink and smell the air, then we're going to probably be having doses of non-heme iron building up in our system. Okay. Looks like I got to the end of the questions. I'm going to check over here on YouTube. Regina says, hi, new here and so glad. That makes me happy. Regina, I'm 20-time fail and try again carnivore. Awesome. One of these times it's going to hit home. Regina, it's difficult if we've been a carboholic all of our life and then we try carnivore, because our old addictions come back because they are a drug and it's feeding the neurotransmitters in our brain. It's feeding our brain. It's not so much the sugar as what they have done to the processed food that has addicted us. And so I congratulate you on keep going back 21 times, 22, whatever it takes, Regina. Do I recommend a brand of MCT? I would get, I think it's Nature Way organic MCT oil. It's on Amazon. It's one that many of my dementia, or I would say it's most of my cognitive decline are taking this particular MCT. It's the only one I felt comfortable recommending. It's on Amazon. It's Nature Way. It's like a brown bottle with a white label with green writing, green and black. So in case you're looking for what it looks like. Midwest Ribeye says, currently driving to Des Moines, past a farmer spraying ditches, smelled so chemically bad. That's what's happening, Midwest Ribeye. It's happening. It's in our air. Quinn says, I love you, Dr. Malea J. Oh, thank you, Quinn. Thank you for the kind words. I appreciate that. Because on YouTube, I get so much bad stuff. Eventually, I'm going to, that bad stuff's going to weed out because I'm not going to quit. They want us to quit. They're probably vegans over there. They're probably somebody who doesn't want to hear about a carnivore doctor teaching people about how to be healthy. They just want to see themselves hurt someone else. They can type, they're hiding behind a name, they're typing, and they're rude. And that's why, that's what happens. I'm putting myself out there. I don't expect anything less from these people because they don't believe in God. They're godless people. They worship Satan. They worship evilness. They're very evil to other people. Okay? In fact, honestly, if you don't believe in God, that does not necessarily mean that you have to be evil. So I don't know what really is in their heads that they have to be so evil over there on YouTube. But I'll weed them out. They'll get tired. They're going to go to the next doctor, the next social media influencer. They'll work on them. I'm just the newest kid on the block over there on YouTube, not with you guys over here. So right now, if you haven't subscribed to me on YouTube, go to @IronLadyDoc. I'm at IronLadyDoc on Rumble. I'm on X at IronLadyDoc. I'm on Instagram at IronLadyDoc. On Facebook at Center Stage Primary Care. It's the Center Stage Primary Care. I'm Dr. J. I'm here to help you navigate your health. You can hire me for a consultation. You want to know the price. I know you want to know the price. It's $110 an hour. For 60 minutes, it's $110 an hour. I'm pretty sure I might be one of the cheapest doctors out there. If you want to join our membership, I have a membership. It's $100 a year. It helps me. You'll get a newsletter 3 times a month. You will have access to texting me. If you start abusing that, I'm just going to tell you, hey, enough with the questions. Let's do a consult, because you're not getting this. And some of the things that you question me about can easily be looked up. Okay? You can look it up. And then you say, I looked this up. Is this correct? I just want your yes or no. Great. Great. Email me if you want either of those, the membership or a consultation. IronLadyDoc, IronLadyDoc at AOL.com. And we'll get you hooked up. So like, subscribe, share. Divine Carnivore, go to her reels on Instagram. I don't know where else she is. Divine_Carnivore. She used to be a vegan, you guys. Her name is Gail. She recently been putting out comic strips. They're awesome. She did one on my dad's history. It was beautiful. I'm so honored that she wanted to do that. I don't know Gail. I don't know her. She read some of my stuff on my post and said, hey, would you be willing to let me do your dad's story? It's opened eyes. It's been shared 5,000 times. People are commenting on it. It has, on my site alone, it had like 150,000 watches. It's gone viral. One little story to get people thinking. So share this. If you love me, Quinn, over there, share my stuff with everybody you know. Click like, do the clickety-clack stuff. Like it, share it, comment. That's how we get these algorithms going. That's all about an algorithm. It's unfortunate, but there's so many people. It's about an algorithm. They're going to pick and choose. They can rise you up and they can bring you down. Don't let them bring us down. We're not going down. We're going stronger. Train hard, exercise. Forget this long distance crap. Do sprints, do HIIT, high intensity interval training, lift weight. Muscle is the organ of longevity. Add in carnivore and muscle, add in glucarin, and you got a recipe for longevity. Your DNA and the telomeres, the caps, tell us that you could live upwards to 120 years. Do you want to live 120 years on statins, affecting your muscles and your brain and causing diabetes and neurodegenerative disorders? Or do you want to live like what you're living? Healthy. No doctor should tell you that because you're aging, you're going to get disease. That is a lie. Because of what you eat or have eaten is what's causing your disease. And they will continue to poison you with more and more medications instead of talk to you about what's causing them, the diseases. There's symptoms of something underlying. And it all goes back to insulin resistance. It all goes back to iron overload. It all goes back to the poison that's in the air. All of it. Stand barefoot on the ground. Get out in the sun. Eat a meat-based diet and eggs. A proper human diet. I stole that from Dr. Ken Berry. I don't think he'll be upset with it. Get out in the sun. Stand barefoot on the ground. Pray. Have something worthwhile to live for. I'll see you back tomorrow, you guys. Please share this stuff. I am live tomorrow, Sunday, every Sunday at 10 a.m. Central. Every Sunday, 10 a.m. Central. Okay? You guys have a great day. See ya.